Okay, let's start first. How about let's talk about education? So, in the United States at this current time, since 2000, the default degree for pharmacists is the PharmD, which is the Doctorate of Pharmacy. This is usually pursued after attainment of a bachelor's degree or accomplishment of all the prereqs that are needed to go into pharmacy school. That usually takes maybe between 2 and 3 years, but by and large, right now the default is have an undergrad bachelor degree. So you're looking at least essentially 2 to at least probably 4 years of education. And then pharmacy school. Pharmacy school is generally 4 years in length, the same length as medical school. And on top of that, it may also be an accelerated program, and which means it just goes year round and such. So you're looking at anywhere between, let's say, minimum 5 if they do 2 and 3 accelerated, or up to about 8 years of schooling and education to receive a PharmD or doctorate of pharmacy. Yes, you could call a pharmacist a doctor, but for all intents and purposes, it gets very confusing in the medical community when doctor tends to indicate a DO or an MD degree. I mean, if you go into physical therapy, a lot of those have doctor's degrees as well, but you don't hear them calling doctors. So, from an academic standpoint, yeah, doctor if you wanted to, but everyone just kind of goes with they're a pharmacist. Now, those that had graduated before 2000 may have what's called a registered pharmacist or RPH or like BS Pharm or something like that. You'll hear these kind of terms that come up and associated at the end, but by and large, the PharmD is kind of like the default this time in the United States for the past 19 years. So that's kind of like, let's put it out there, that's kind of the educational level. So what is it like to educate a pharmacist? By and large, I'm going to go with a 4-year model because it's probably the easiest for you. And it's where you're going to see the most probably pharmacists coming from those types of schools. That's where I went to, that's the type of school I went to. The first year tends to be a lot of just the basic sciences. And what I would say is like, you might get pharmacokinetics, pharmaceutics, which is a preparation of drugs and such. You will come across possibly physiology, anatomy, kind of the basics, like how does a body work, what are different receptors present in the body. And the thing is that most people don't realize that a lot of for the pharmacist education is you need to understand the body, because if we're talking about medications and drugs and how they work, then you kind of have to know where they function. So understand the organs, understand the body mechanics. What is very different though is that compared to like a medical school program, we are not going to be going hardcore anatomy. We're not going to know every single nerve and location. We don't do cadavers and such, for instance. We don't go down that path. But so the first year is very much scientific knowledge and very hardcore with that, biochemistry and stuff. Then come the second and third year, you start getting more into what you would say is like the pharmacy stuff. Probably by the second year, you might see some emphasis on like basic pharmacotherapy. Usually starts with like over-the-counter kind of drugs, like how does Tylenol work, how does NSAIDs work, what's the difference, just knowing like, mechanism of action. You might talk about like arachidonic acid cascade, for instance. So along with understanding the drugs themselves, then you have pharmacology, how do they work in a body. Big one is pharmacokinetics. So how is it absorbed, how is it metabolized, how is it excreted, for instance, and go throughout understanding drug interactions, such, understanding pharmacogenomics. And after the initial, let's call it the easy path with these kind of drugs, and you move on to usually what's a disease approach. So you go through a systems-based. So for instance, you might do cardiology and spend time talking about hypertension, CAD, ASCVD, STEMI, heart failure, hyperlipidemia. And along with that is this implementation of, usually what you'll see is talking about what is best practice, usually following guideline approach care, and where did the drug treatments fall into place there. So maybe you're surprised by that, but yes, their pharmacists are basically taught what is the right treatment, what is the best treatment for this patient on a case-by-case stance. So I would argue that that's what we'll call the P2 and P3 year. So P1, P2, P3, P4. It's kind of like MS1, MS2 and such. So your fourth year tends to be rotations. So by and large, most pharmacy students will have completed, let's say, over 1,500 hours of clinical experiences. In that last year, generally from what I see is that students will have at least six rotations, each one about 6 weeks long, where they're assigned under a pharmacist preceptor at a location. Now, there are 4 types of rotations that all pharmacists have to really go, and this is for accreditation standards. One is basically ambulatory care, which is clinical practice outpatient side. Then there's internal medicine, which is clinical practice, usually in some kind of facility or in a hospital. And then there is what I would call like how does a pharmacy run outpatient. Usually that's at either like a chain pharmacy, independent, maybe compounding and such. And then how does a pharmacy work in an institution? That could be a long-term care facility. It could be usually generally a hospital. And so you had like two core rotations in clinical, out and in, and then two staffing or operations out and in patient. And then you usually have 2+ electives. For pharmacy students, you'll see that kind of change a lot. They may go into things like industry. They may do like medical writing. They may do regulatory affairs at the FDA. They may do Indian Health Services. It varies. Like it's practically wherever a pharmacist can work, and that tends to be where a lot of students like self-discover themselves and figure out what they kind of really have a passion for. Also, throughout pharmacy schools, there's multiple clubs and activities that you can see, and this is where students can achieve leadership positions. Along with that, a lot of them may engage in research. They may do benchtop research in pharmacy sciences, or they may do like clinical under pharmacy practice. So it varies. But what I want you to take from this is that in terms of an educational level, if you get anything from this, it's not that they go to school to learn to count by fives. That's not it. More or less, it is a heavy focus right now in the PharmD curriculum to stress clinical output from our students. One of the things is that then multiple schools may vary in terms of levels of attainment for areas of like genomics, informatics. Sometimes some more do stress more clinical or not. Some stress more sciences than not. Business as well, entrepreneurship. Some schools may stress more. So it kind of like, it will differ where they go. But that's so, I want to wrap this part up and just state one thing you should take away is your pharmacist is heavily educated. The reality is that they're more than capable of assessing literature and understanding a lot of clinical constructs that you may be looking for in a company, and you may have thought, "Wow, we needed a clinical content expert for us," and you may default say, "I want to hire a doctor." Well, ask yourself, what kind of doctor at this point? Do you want an MD/DO, or can a pharmacist actually fulfill that role? That's something you need to look into and question. So let's end that section here about education. We'll move on to the next one.